Hey, this is King here. I'm a health insurance advisor, and glad you took some time off today to check me out. It's been a while, and today I'm going to go over a very interesting topic. And I've been planning to do this for a while, and I think it's a good time to go over this because I've got some questions, and I would like us to start off with those questions, and I will walk through it and see if it's something worth, you know, discovering. My first question is, why is your dental and your vision coverage not part of your health insurance? Find out at the end of this whole conversation today. Great. And if you don't know me, if it's the first time you're jumping in here, this is King. I'm a health insurance risk advisor. A lot of people would define themselves as insurance agents. I really don't find that as a very appropriate description of what I do, just because I actually go beyond just being an agent, right? I'm not trying to sell you anything or ask you to buy anything. Really, that's not my objective today. I want you to keep an open mind, right? Take your mind out of any contraption that you have right now looking at this video and put your mind in a place where we're asking questions, right? What is it that your health insurance doesn't cover your dental plan as well as your vision and your hearing? Even though they're, absolutely part of your body, right? So your ear, your mouth, and your eyes are part of your body, but they're not covered under your health insurance. So we want to figure out, why is it not covered? And if so, why not? And what can we do to get that risk out of the way? So let's jump right in, okay? All the fun stuff away. On a very serious note, I'm a licensed insurance agent, and I always go with the advisor role, because that's really what my role should be, right? A fiduciary advisory role. So I tell you what your money should be doing for you and why you should put your money in anything that you put your money in to get you the best deal out of what you do. So in this whole discussion today, I'll really keep my conversation around why dentals, vision, and hearing are not covered under your insurance. Ever wondered why? Well, that's what we're going to deal with today. Now, the main reason why that is because it's federal government regulation. Very simple. Let's cut the long story short. And this is because by federal regulations, your dental, your vision, and hearing coverage is considered a separate entity, as they would like to call it. Separate entity here simply means that your health insurance company has no obligation to cover you under your dental, your vision, and your health coverage. That's really what that means in a very simple layman term, okay? And I like us to leave that at what it is. So let's dive right into why and how that became. So it's really a federal government program that said, okay, we don't want to cover you, just because if we do, we'll probably have to spend more money, right? The insurance companies will spend more money. It means they would have more obligations towards the government. And in whichever case, there's more money to be spent. That's bottom line. So we're going to split this up, whereby you can get your health insurance, you can get your dental insurance, your vision insurance, and every other insurance that you can think of out of your normal health insurance in a separate coverage. So that's really what that came down to. And my objective today is to dive in and see what you can do to take care of that risk, right? I mean, if you have a toothache or a filling problem, or I'll give you an example. I had a very crazy one lately. Went to the dentist's office and the tooth pain. I said I had a tooth pain. They went over it, did a necessary stuff, checked it out, did scans, x-rays, and oral exams, and then came back and tell me, well, there seemed to be a pain and we got to fix that, and we take about $2,500 just to put an antibiotics in your teeth to get you out of a pain. Guess what? No insurance will cover that. I got to come out of pocket for $2,500. that. I'm not going to name names, but that's a very good real life experience. It happened to me last month. And I asked them, but why is it so important for you to give me a $2,500 bill instead of taking care of my emergency? Because I'm actually going through an emergency right now. I need my teeth taken care of. And she was like, well, that's what it is. Insurance don't cover it. So you got to pay out of pocket, or you can, slide. So I told them I would slide. I'll go ahead and look for alternatives. Well, that's another story for another time. So let's carry on. But that's really just my real life experience with what dental coverage really looks like right there, out there in the market. It's a wild, wild west business. You can get anything from a couple of thousands to over quite a few thousands and millions if you want. It's a free ride in that industry right now, just because there's no regulation technically. They have a right to charge you what they charge. Insurance companies typically would give you a certain limit, right? Most of the time, the dental coverage would say, well, we'll give you about 1,000 or 1,500 or 2,500, and that's all they can cover, right? And once you've hit that amount, they have no obligations towards you. So I think it's a very interesting topic to find out why it is that way and why they give them that amount of flexibility to play around making money out of your predicament. So what I want us to do today is really look at what are the risk factors of you getting into a situation like what I just explained, and how you can take care of yourself, right? That's really bottom line at the end of the day. And it's really taking care of yourself, right? Because if you're not feeling good, everything else is not going to be good. That's how it is. That's what just life is all about. If your tooth is aching, your eyes not seeing right, things are going to go wrong, That's really simple. So what I'd like us to do here right now is look at what you can do to fix that. And what I mean here is, anytime you look for things like that, you want to look at why you need that coverage, right? If you think, or if you suspect, if you did an oral exams, most of the time those things don't cost you a dime. That's what I want you to remember. You go into a dentist office, have your oral exams, your x-rays and all that stuff done. If you have insurance, they don't cost a dime. As a matter of fact, even if you don't have insurance, most of them are covered under preventive services. So take advantage of that and get it done. What you want to be careful about is, after that preventive services is done, what comes after that. Because they were going to put you in a private room, get somebody looking really nice and cool, come talking to you about what you got to do. This is what we can do. This is the treatment plan. This is what we have. This is what we have. X, Y, Z, and you can name it. But what I want you to take out of all that bullshit there is, you got to put your heads together and see, is this something that I can afford? Is this something that is worth doing? They might just be recommending something to make their bills, to make them ends meet. Is it really worth it? Is it something you need? Is it time for you to do it? So all of those things should count up to why you should have a coverage, why you should do what you should do, and, take care of yourself, bottom line. So if you don't see any of those things really being necessary, don't do it. Doesn't really matter, right? You can go and check with other dentist offices and see if it's worth doing it. If it's not, simply say, well, I don't want to do it. Nobody's going to force you. You got a choice. So you have to always put yourself first, your evaluation, your situation first. And if you see the risk factors are higher, so if you see, for example, that there is a filling, or there is a crown, or whatever, dentures, whatever that has been overdue coming up, and it might come back to bite you, then you want to start shopping for insurance that will cover that really nicely, right? So at that point, you want to spend the right money that will take care of that. Just keep in mind, dental plans typically tend to cut you out at a certain amount. That's just because they really want to limit their liability, right? If you spend that much, they don't want to cover you after that much has been spent. So you got to keep that in mind when you're shopping. I'm going to throw a couple of links around